Welcome. This is Joni Eisenberg, and we are very excited about the show we're going to be sharing with you today. We continue to lift up the revolutionary spirit of Dr. Martin Luther King in this January 2026, and I'm going to share a very important quote from Dr. King that he gave 70 years ago in Chicago. Of all the forms of inequality, injustice in healthcare is the most shocking and inhuman. And of course, that quote is just as relevant, if not more so, 70 years later. That was part of a speech that he made in Chicago in March 1966 at an organization called Medical Committee for Human Rights, MCHR. This was at its second national convention. Some of you may not be familiar with MCHR as an organization I was very much a part of. It started down south in Mississippi, went up to Chicago, and Dr. Quentin Young, who was later one of the founders of the movement for physicians for national health care and single payer, invited Dr. King. In fact, Quentin was Dr. King's physician when he was in Chicago. That speech was again made in 1966 at this convention, and it couldn't be more relevant today. Unfortunately, our healthcare system continues to get worse. It's hard to imagine that this is happening, but in fact, it is. We're going to start with talking about the national crisis in healthcare and actually the expansion in organizing for universal healthcare that's taking place. That's going to be our first segment. And our second segment is going to be focusing on the ongoing healthcare crisis in DC. And we will be focusing in Southeast DC with a crisis at Cedar Hill Hospital, a mounting crisis which thankfully the community is really addressing. A special guest in that segment is Dr. Marilyn Corder, former key physician activist at the historic United Medical Center, which was closed last year to open Cedar Hill Hospital. So again, I'm honored and thankful for this show we're going to be discussing. And I just wanted to mention too about MCHR. Again, the quote was from MCHR convention that Dr. King was the keynote speaker. That organization was about 10 years later abolished or attacked by COINTELPRO right around the same period that the Black Panther Party was attacked, but you don't hear about it as much. But I witnessed it firsthand, how that organization could no longer function due to the powers that be. And of course, it evolved into other movements with other people. But it's important to note that Dr. King was very much involved with that organization when he made that statement. So here we go. I want to just let listeners know my system is not working too well. Thankfully, I can be on the phone, but everyone else is going to be on Zoom. And we're going to start out with One Hero, One Shero. And of course, we have on Dr. Edwin Chapman, who many of you know, who is definitely a hero in our community, practicing healthcare for over 40 years. We're going to be hearing what he has to say, particularly about the structural racism in our healthcare system and much, much more. And Dr. Chapman will be with us for the hour. Our other guest is Dr. Anna Malinow. She is with the National Single Payer Organization and will be talking with us about a very exciting webinar with Senator Christopher Van Hollen. Welcome, Dr. Malinow.
Thank you, Joni. It's a real honor to be here today with you and Dr. Chapman. And I am a retired pediatrician. I retired after 30 years of practicing general pediatrics. I live in San Francisco, and I am one of the organizers for National Single Payer. We're an organization, a national grassroots organization that organizes locally for national single payer. We believe that healthcare is a human right, must be free from profit, and will be achieved through national legislation. National Single Payer hosts a webinar every month. We are really, really honored and happy to have Senator Chris Van Hollen, whom all of you and your listeners know. as our keynote speaker. And the reason why we asked him to come is because back in December of 2025, he was the latest lawmaker to endorse Bernie Sanders' Medicare for All bill, Senate Bill 1506. But he went further than the typical Democrat. And what he said was something that really struck us. And that was that he said, yes, let's extend the Affordable Care tax credits to prevent a huge spike in healthcare costs for millions. But then he went on to say, then let's finally create a system that puts your healthcare over corporate profits. We need Medicare for all. Of course, we all admire the senator for all of his stands and principled stands on so many issues. But when he endorsed Medicare for All and made those statements, we really, really wanted to make sure that we could have him speak to our audience. So that's what's going to happen Wednesday, January 28th at 8 p.m. Eastern. You have to register for the webinar, and it's very, very easy. All you need to do is to go to our website, which is www.nationalsinglepayer.com. nationalsinglepayer.com, and you will find a way to register. If you just scroll down a little bit to our webinars, there is a button there that you can click and you can register for the webinar.
Yes, and we're going to ask you to hang in here with us to the end of the show, and you can repeat that information before we close out. And of course, for people who do not know, Senator Chris Van Hollen is part of our community that represents people in Maryland. So it's very exciting and very important that this free webinar happening is taking place. Webinar on Medicare for All with Senator Christopher Van Hollen. What else would you like to say? And unfortunately, the only few minutes we have about the struggle we're facing in this country for health care.
So I think that the situation is very dire. We really are at a healthcare crisis today. From north to south, east to west. People that are fortunate enough to have health insurance are feeling the hikes of healthcare premiums. So, of course, with the expiration of the enhanced subsidies on the exchanges, people are seeing their premiums skyrocket from hundreds to thousands of dollars per month. And as a result, millions and millions of people are going to lose their health insurance because they can no longer afford the premiums. Now, let me say that with the ACA, those premiums, just because you pay for premiums doesn't necessarily mean that you are even getting healthcare coverage. Because in addition to the premiums, you also have to pay very high deductibles before your insurance company kicks in 1 penny for your healthcare. So not only are people suffering from the amount of money that they have to, but they're also terribly underinsured, because that means that whenever they need to pay for they need health care, they have to pay exorbitant amounts of money out of pocket. And many people just choose not to. And then they go without. And we know that a high percentage of the people in this country go without healthcare, despite the fact that they have health insurance. So these premium hikes aren't just affecting the 24 million people on the exchanges, but it's also affecting the 154 million people. The 154 million people. No, I was just mentioning that people that have the fortune of employer-sponsored health insurance are also going to be seeing incredible hikes in their health insurance. So now it costs about $26,000 per family on average to pay for health insurance per year. And those are the premiums. And those are going to be going up, which means that employers are going to have to be paying more money, and which means that the workers are going to be taking less home pay because of the fact that the insurance companies are getting richer and richer and richer. So I think what we need to do is, as we're in the middle of this crisis, in addition, of course, we know that the HR 1, which is the Reconciliation Act that was signed by President Trump in July of last year, is going to cut $1 trillion from
This is Mari calling again. Can you let me?
it's going to cut $1 trillion from Medicaid, which means that not only are people going to be, millions of people will lose their Medicaid coverage, but hundreds and hundreds of hospitals are going to probably have to shutter. And in fact, the Shep Center has created a list of about 330 rural hospitals that are at risk of shuttering as a result of these draconian Medicaid cuts.
Okay.
So really what we need in this country is to come together and already more than 50%, of course, depending on whether you're Democrat, Republican, or independent, most people in this country support a national Medicare for all, improved Medicare for all, and that's what we need to demand, and that needs to be on the nation's agenda. And that's what Senator Van Hollen from Maryland is going to be talking about on Wednesday, January 28th.
Okay, you're listening to Anna Malinow, and she is with National Single Payer, talking about an important webinar on Wednesday. I want to ask Dr. Chapman to jump in and make his comments about the national situation. We're soon going to be jumping into what's happening in D.C., but Dr. Chapman, I know you have a lot of wise words to say about this horrific healthcare system we've had for over 100 years, based on greed, structural racism, and much, much more. So what are your initial comments this morning, Dr. Chapman?
Joni, it's an honor to be on with Dr. Malinow. We happen to both have our hoodies on as well, and that wasn't planned. I just met her this morning. I looked at her bio, and so many of her comments related and readings from the Journal of the American Medical Association, talking about how our insurance company is really a fraudulent system, and it's set up so that these payers can upcode and downcode whenever they get ready, and they can cherry pick and lemon drop patients whenever they get ready. So it's really on January 22nd, the House Ways and Means Committee and Commerce and Energy both had hearings with 5 of the top CEOs from the insurance companies. And again, it's pure gamesmanship. These CEOs and companies are making billions of dollars while they starve patients and frontline pharmacists and providers. We're really seeing the what I consider the end of our healthcare system. And it's interesting that you mentioned over 100 years. When we really look at it, this system is really grounded in circumstances after the Civil War, when it was realized that and said that a sick slave didn't need white man's health care. And that system has been perpetrated and progressed to today. So we really are now looking at what I call a sharecropper system, where we have the plantation owners are making the money. We do the work, but we stay perpetually in debt, and that's where we are. I've seen my income drop in half in the past several years, in spite of the fact that the patient population that we take care of, which is particularly high risk because all of them are opioid addicted. So I calculated the fact that in treating 160 or 170 opioid use disorder patients, 96% of whom have been exposed to fentanyl and other drugs, that we actually saved the district government somewhere between $30 and $40 million. Reduced criminal costs, reduced infections, families are able to stay together, children are not forced into foster care. So all of those are factors that we see in our community that are compounded, and they're what some people refer to as lost leaders or things that we don't think about because they're outside of the healthcare system. But those savings really accrue across the board, and the taxpayers pay for all of them. So if someone is not treated, they go to jail.
And of course, the insurance companies are more and more and more prioritizing. They're making millions, billions of dollars while denying health care for people who need it. It's happening much, much more. I'm personally witnessing it with a friend who was very sick. Insurance companies cut out the care that was helping him get better, and they do that all the time. So we're going to move in a second to talking about what's happening in the district. And any final words, Dr. Chapman, about that, the national situation with the insurance companies?
So there's several reports that I would recommend everyone to read. Certainly, there's been much written after the two hearings on January 22nd, but also there's a report, I call it the Grassley report, that was submitted that really shows in detail how United Healthcare is a prototype for the other insurance companies. And actually, they train their people. They're now using what's called generative AI to create these charts that look like patients are sicker or not as sick so that they can make money. Another report was issued by the Legal Action Center by David Myers from Brown University, and really goes into detail. The so-called star rating system for Medicaid Advantage actually has no proven outcomes improvement. So these are the types of corporate fraud, or really it's RICO. It's racketeering information and corrupt organizations that is running our healthcare system.
Absolutely. We have crooks running the system, and we are very honored and thankful to have our healthcare heroes and sheroes with us for the hour. Our theme is Dr. King's words: injustice in healthcare is the most shocking and inhumane. And we're going to ask Dr. Malinow to hang on with us and make some final words before we close out. But now we're moving into the District of Columbia to talk about some of the very upsetting things that continue to take place. We're going to be focusing, for the most part, on what's happening in Southeast at Cedar Hill Hospital, but of course we'll get into other issues. We have at least two wonderful sheroes joining us. If there's anyone else on, I may not be able to see them, but we're going to be speaking to Dr. Marilyn Corder and Kim Dickens. I am very excited, as I've worked with both of them over the years. And I'm going to ask Dr. Chapman to help me introduce Dr. Marilyn Corder, who is one of my sheroes. And if you know her, you should know her. She is one of our healthcare sheroes in the District of Columbia, 46 years of service in D.C., and her work is just amazing. But Dr. Chapman, why don't you help me welcome and introduce Dr. Corder?
It's certainly a pleasure. And Joni, I'd like to correct something that you said early on. I've practiced for 50 years. Marilyn was a couple of years behind me at Howard University College of Medicine, but we had very similar training at the old original Freedman's Hospital. We transitioned those patients to the new Howard University Hospital, and both of us had experience at DC General Hospital. So we were there at a time when all three medical schools in the District of Columbia had students, residents, and faculty, as well as paid staff. And I tell people that I saw things in one night at DC General that I've never seen again. So we're now talking about a community hospital that virtually has the same patient population, but well, I'll let Marilyn explain that to you. But it's really a tragedy.
Yes, and after we're also going to be joined by Kim Dickens, and I'm going to ask Kim to introduce herself as well. But let's start with Dr. Corder, who worked I met her when we were fighting maybe 7 or 8 years ago to try to save a United Medical Center. But Dr. Corder, welcome and good morning.
Thank you, and good morning. But I am honored, Joni, again to be on your show. I am so honored to be here with my brother Ed Chapman, as well as Kim Dickens, as well as Dr. Malinol. Let me just go all the way back. It's been 20 years since we started to fight to keep what I lovingly call Greater Southeast open, which is, of course, United Medical Center. I was sent over there, I should say deployed over there, when at that time GW was taking over, was covering the nursery. And they called me and said they're leaving, something about pay, and we need somebody right away. And that Monday I had to come and start, and I had a team of 2. And we covered 24 hours. So that meant my neonatologist was there during the day, and I was there at night. And that lasted, wow, we're talking 10 years. My husband joined us a year later. So it was the 3 of us. We had no medical students. We had no residents. It was us. And I was honored to be there because that's where I grew up. I am a Ward 8, born and raised there, Washingtonian, 3 generations. And I love Ward 7 and Ward 8. And I love taking care of those who reside in Ward 7 and Ward 8. So fast forward, we were there. The city, we had 3 or 4 managers, and each manager took a chunk out of us. And as we continued to take care of the sickest residents in the District of Columbia, we then heard about this plan of a new hospital, and our hopes was to stay open.
And
I said, well, why can't there be 2 hospitals?
Dr. Corder,
Okay.
Of course, let listeners know that before United Medical Center, there was Greater Southeast Hospital, which, really became very critical when DC General was closed. So what you were doing at UMC is part of that history.
Absolutely. And that was the only hospital in the residence. And prior to that, it was CAFRS. But when DC General closed, as Dr. Chapman talked about, we learned so much, and that covered a lot of the Northeast Corridor and some of the Southeast Corridor. Then it was just United Medical Center. We were busy with the emergency room. We were busy up on the unit. We were busy delivering babies. And then again, it was an idea. The city said, oh, we should have a brand new hospital. So initially we said, well, that's a good idea, because we need to make sure that we have the services. Like in Northwest, there are 5 hospitals. Why not have 2 in Southeast? But then as we continued to listen, the council was saying, well, we'll close United Medical Center, which didn't make sense. And then they said, well, not only are we going to close it, we're going to staff it with just GW doctors. And that was something that we thought was just absurd. We protested. We had our white coats down at the council. I was there so many times, of course, Joni. And we said, well, what's going to happen? We have our patients, and we need to be there to service our patients that we have served for decades, 30, 40 years. They didn't listen. They shut us down. They first stopped the nursery. The nursery was closed at least 5 to 6 years before the hospital closed. So the women who are up to 50% of those babies born in Washington, D.C. come from women from Ward 7 and 8. They had no place to deliver in their ward. So unfortunately, there were babies.
I must say that it was, I'm sorry to say this, but it was the head of the D.C. Health Department who helped to shut that down. It was disgraceful. So I'm sorry.
Yes.
Keep going,
yes.
Dr. Corder.
And absolutely. And mothers were in labor trying to get across town however way. Babies were born in Ubers and taxi cabs on buses. Sometimes they'd come in because we were still the closest hospital at the time and deliver in the ER. So it was a tragedy. Or they would go across to Prince George's, but no one was listening. And we tried and tried. I became chief of staff, and no one was listening. And they were like, oh, we're fine. We have this brand new, and the city paid, of course, $413 million to open up a hospital that they formally said, we don't want doctors from UMC. They're not invited to the table.
Right.
We don't want doctors from Howard.
Howard. They did not want doctors from Howard University. Basically, they were not allowing Black doctors to serve the hospital. I mean, and we were, I'm sorry, but Dr. Corder and I worked together with the community. We had many meetings, and we fought and fought,
Yes.
and we predicted exactly what happened was going to happen. But the fact that they would not allow African American doctors to work in this new hospital it's just horrific. So I'm sorry, Dr.
And a
Corder.
predominantly, no, Jay. And unfortunately, we're talking about outpatients. We're talking about
Yes.
doctors who knew them, who knew their families, who were culturally aware of all of their illnesses. So there's a trust factor with our patients, and if we're not there, they're not there. And we predicted it. And the promises of having these things open and all the doctors coming over from GW, Foggy Bottom, to cover and staff, to this day, it has not happened. And
Right.
unfortunately, we're seeing the result of that. Our residents in Sport 7 and 8 are suffering. And
Yes.
it's like it's a medical tragedy. They shut us down, and now they're closing doors or they're not inviting. So we've been meeting with them, and hopefully they hear us, because now
Yes.
the commissioners and the residents are speaking up, because they said this is just not fair. This is not what they promised, and here we are.
Yes. And again, you're listening to Dr. Marilyn Corder, one of our healthcare sheroes in the District of Columbia. We're happy to bring on Kim Dickens, who is another shero. One of the things Kim will talk about, there was, as Dr. Corder alluded to, there was a very important meeting this past Thursday dealing with Cedar Hill Hospital, a very intense meeting, I understand. And Kim Dickens, welcome. Please introduce yourself better than I just did. But Kim is playing a key role in this struggle.
Good morning.
So welcome,
Thank you
Kim.
so
Good
much.
morning.
Thank you so much, Joni. Can you hear me?
Yes, we can.
Yeah, okay, wonderful. Thank you so much for inviting me on your show. It's my pleasure. So, yes, I am Kim Dickens, and I am a healthcare consultant, having worked in DC Medicaid, mostly with the MCOs, 20 plus years, and also as a pharmaceutical drug rep in the District of Columbia for 10 plus years. And so I actually got a call regarding Cedar Hill.
And let me just say, you are also a native Washingtonian, very much involved with the community.
Absolutely.
Mm-hmm.
Yeah, a proud Washingtonian, fifth generation. Yeah, I am. Regarding the Cedar Hill Hospital and the issue that's going on right now, I think the good news is that I believe the district government and GW as well, UHS, are looking to make some changes and move in the right direction by hiring the community physicians, I will call them, those physicians that mostly out of United Medical Center, as Dr. Corder talked about. And originally, as Dr. Corder mentioned, they were not invited to the table when the hospital was being developed, and certainly not during the negotiations. But as it stands now,
being the community doctors, right?
Yes, community physicians, yes.
Mm-hmm.
So regarding the meeting last week with the board of Cedar Hill, they allotted the community physicians time on the agenda to discuss the issues and talk about what these physicians can bring to the facility. Number one is the patients, right? So, which is what they don't have now. So these physicians are have the patient population not only in Southeast, but in Ward 7 and 8, but throughout the District of Columbia, and have been servicing these patients or these residents for 30, 40, 50 plus years, some of them. And so again, I believe that the government and GW are now willing to listen, bring the community doctors to the table. They understand that the original plan for the hospital in terms of staffing was not sufficient. It did not work. It is not working. And so that's the good news.
Yes. You're listening to WPFW 89.3 FM. This is Joni with True Heal DC. I'm not sure if Chuck Hicks is on or not, but we are talking about the crisis, ongoing, really criminal healthcare system in DC as it is around the country. We have some good news today, but we also want to go back and highlight for listeners who may not know the terrible problems that have been happening at Cedar Hill. We have two wonderful guests in addition to Dr. Chapman, Dr. Marilyn Corder, and Kim Dickens, and talking about the meeting last Thursday at Cedar Hill, about Cedar Hill with their board. I happened to hear a very strong statement from Trayon White. I wish I had been able to play it. Maybe he'll still call in, but it was very encouraging and inspiring to hear the words from Trayon White about what is happening and what has happened at Cedar Hill Hospital. But Kim and Marilyn, perhaps, and Dr. Chapman, for listeners who do not know some of the horrible things that's been taking place at Cedar Hill Hospital, with the lack of the difficulty in people getting basic care. And hopefully this may turn around, but let's make sure the listeners know what the problems have been. Do you want to share some of that, Kim, and then Dr. Corder?
I will refer to Dr. Corder regarding the lack of staffing or services.
Some of the stories of patients not able to get basic care. I mean, there were horrific stories that I can't recall all the details, but Dr. Corder, do you want to share examples of some of the problems that residents were having in just accessing basic care there?
Sure. Quite a few of them have already been aired on the news. But the problem when you have a hospital that is so short with staffing and limited in terms of specialties and the need, once they present to the ER, to the emergency department, the residents will have perhaps a need to have surgery. I know I have a patient who had an acute abdomen, meaning they had to have surgery. And the mom said she was 12 hours in the ER, and finally they diagnosed her son with appendicitis, and then told her that, well, we don't do that here, and you'd have to take your son to Children's Hospital. And she was told she had to drive her car as opposed to transportation. And she was like, what? And so the fact that they're open and they had the ribbon cutting and not have all what they need for services, it runs into major problems in the practice of medicine. When you have someone who is there and they feel, well, this is a complete hospital. So the reports from the residents and the tenants have said they've been rude, they're not, feeling comfortable there, as well as they don't have the service and they have to go to GW. And often they've been transferred to GW, where most other hospitals would be able to service them right there in the same hospital, but they don't have that. And the specialties and the surgeons, et cetera, we have in the community, we have as part of our community docs. And if we could just be there and open up, then the practice of going straight to GW when the need is beyond an urgent care emergency room need would be eliminated. And the time that it takes to do the transportation, to do the evaluation again at another hospital is critical. It's serious. And unfortunately, sometimes bad outcomes happen. And the bad outcomes can be fatal and or irreversible.
Yes, and I know you stated that the some of the bad outcomes were shared in the news media, but perhaps if you or Kim could just summarize one or two of those horrible situations where patients had relatively things that could have been and should have been treated, but were not. Are you able to share one or two briefly? If not, we can
Well,
keep.
I think because there are legalities right
okay,
now.
I got you.
Yeah.
I
Okay.
don't want. I can say that some of the bad outcomes have resulted in the lack of services and the lack of specialties at Cedar Hill, and it's been almost a year. And if they could have opened up with a full staff and there are doctors who want to be there, and have things have been prolonged with their applications, etc. So that's why we had the meeting, and hopefully the meeting with the board brings attention to this urgent matter.
Yeah, so that's the good news.
Add,
Yes, Kim.
Joni. Yeah, let me just add that things could have been de-escalated had the hospital been properly staffed with folks that were culturally competent and sensitive, and also, with the correct clinical leadership.
Absolutely. And, it's very weird. I mean, it's very upsetting to have experienced some of these things when we were fighting to keep United Medical Center open. And, it's hardly even discussed. I can remember the Howard physicians and student physicians. Some of you may remember Dr. Jesse Barber, who was a hero in the health community, was at Howard for many, many years, is one of the reasons why we have this radio show. He encouraged us. And Jesse Barber's daughter was very much involved with the protests and the organizing to demand that physicians from Howard be allowed to work at this new hospital. And there were protests and demonstrations. It's important for us to remember this history because it wasn't that long ago. And I'm going to ask Dr. Chapman anything he'd like to say. I'm going to say that he refers, and I agree with him, to DC's criminal healthcare system. It's been, as long as I can remember, before I even moved to DC, which is in the late 70s, DC was known for the highest rates of infant mortality. We still have the highest rate, I believe, of kidney disease. I think highest rate of maternal mortality, on and on and on. And this has been going on for far too long. And we're sick of it. Dr. Chapman, I don't know if you want to jump in about the long-term horrific care, of course. And we remember, some of us do still remember the closing of DC General, which, the moneyed interests got together and made sure that no matter what, they would close down that hospital. And there was never, ever, ever a report. And I know because I worked in that DC health department, never was there a report about the impact of the closing of DC General. And it's hardly even talked about. But now, Dr. Chapman, did you want to comment in general about anything about our healthcare system in DC?
Yeah, so Joni, let's take a satellite view of what kind of healthcare system do we ideally want to see. We would like to have physicians, nurse practitioners, PAs in our community, perhaps within walking distance of someone's home. So some of the things that Marilyn talked about, transportation, that patient no longer has that cost. It's much easier for them to access a physician to get services. So our goal is to prevent tertiary illness. And you do that by getting what we call preventive health care, meaning that you get periodic examinations, you get immunizations, colonoscopies, mammograms. All of those are preventive services. If you don't have providers in the community, then you show up in the emergency room with a much higher level of disease, which costs more. So what we've just described was the fact that at that board meeting, there were at least 12 to 15 physicians with over 600 years of service in the community that suddenly was extracted from the community. 600 years. So that means that even if you do go to the hospital, what happens when you're discharged? You go back to the community and you're now going to have to travel across town to get follow-up care. So we really have to understand that satellite view of what a good healthcare system looks like. And a good healthcare system has pediatricians, family practitioners, mental health services right there in the community, so that we reduce all of those errors.
Absolutely.
And Joni,
primary care doctors who actually talk to their patients. Ambrose, we're very happy that you could call in, and you are organizing a very important town hall meeting at the end of February. So welcome and tell us about that, or whatever you'd like to say.
Well, thank you, Joni, and thank you for having me on. But I know all of your guests and have worked with all of your guests. And even I know a relative of Dr. Corder who is working in Africa to provide health services in Africa. And of course, I work closely with Dr. Chapman, especially on the opioid crisis. But there's more to this than what we're talking about. Medical Faculty Associates, which is supposed to be the organization staffing the hospital, is losing money. They've lost about $444 million over the last several years, more than the total cost of the hospital. How did the mayor and Wayne Turnage not know that they were losing that much money and therefore were unable to staff the Cedar Hill Hospital? There are at least close to 500 vacancies at the hospital, as reported by Councilmember Trayon White. It's losing $5 million a month. Now, how is it that we are in this situation when they specifically excluded Howard University, specifically excluded Black doctors, specifically excluded community voices in the development of this hospital? And I want to remind everyone that it was the Health Alliance Network that fought hard for that hospital to be a level 3 trauma center. A lot of people don't know what that actually means, the difference between a level 3 and a level 4 trauma center, which is what they wanted to make it. A level 3 trauma center can treat gunshot wounds, can treat stabbings. And right now, if someone comes into that hospital with a life-threatening gunshot wound, they have to be transported to another hospital. It doesn't even have as many services as United Medical Center had. So they don't even have the requisite number of services. Now, Dr. Chapman hit it right on the head. In addition to the services at the hospital and the doctors at the hospital, a healthy healthcare system would have a medical office building right there in the area where doctors can have their offices so that patients can go and see those doctors either at the hospital or at the medical office building. And there's nothing of the like that is there. And that is part of the problem. They created a urgent care center down MLK Avenue that was supposed to relieve the hospital of all the patients coming in for minor things like a broken wrist or a broken ankle. That was supposed to be handled by the urgent care, but that has not happened. It hasn't transpired that way. And so patients are coming into the hospital with minor things, and patients that come in with major things can't be treated. I had a relative, my own relative, that had to go to Cedar Hill Hospital and went into the hospital at 8 in the evening, and came out at 7 in the morning. not having been seen by their emergency department. This is a critical issue. So the Health Alliance Network is going to have a town hall at the end of February. We're going to announce it next week, as soon as we have the exact location and the date. We know the date is going to be either the 24th or the 25th of February. But we're going to have a town hall, and we're going to go through this. This is unprecedented in another Black neighborhood in Black DC. How is it that the mayor and Wayne Turnage didn't know of the money problems of UMC and of medical faculty associates that would impact the growth of Cedar Hill Hospital?
Yes, and unfortunately, we're almost running out of time. I want to encourage people to listen to Ambrose today at 5 p.m. You're going to be on, right, Ambrose? And every Monday
yes,
at
and
5 p.m.
I will have the Washington Post reporter, Jenna Portnoy, on at 5:30 to talk about what's going on at Cedar Hill.
Very good. And Ambrose, we're going to support you in making sure that PFW listeners know about this very important town hall the end of February. And you're listening to WPFW, to Heal DC. We're almost out of time, so I'm going to actually ask our guests to make their final comments. Let's start with Kim Dickens. What are your final words or messages for today?
Well, hi. Yeah, so my message is to stay hopeful that we can get this issue resolved at Cedar Hill with the right physicians and staffing. I see that, this could actually be resolved, and I'm looking forward. Thank you.
Yes, and I want to thank Kim Dickens for her leadership in this issue. I understand she was definitely very critical and influential in making sure that this was a productive meeting last Thursday, and I'm very thankful to have her on. I love her dearly. Kim Dickens is also very close to Marion Barry, and we're happy to have her on in this struggle. Dr. Corder, your final statement for today.
It bothers me immensely that we've been a whole year and we have not done right. This district have not done proper for residents of Ward 7 and 8. And they're just hanging out there. So I want to make sure that if all of you who hear me, be it residents of 7, 8, or whomever, if we can just make sure that the services are there, that the residents are entitled to. As Kim said, we had a meeting. I don't think we should wait forever, but we definitely will give them a little time. But meantime, we will continue to galvanize, continue to observe, and continue to fight for the rights, the medical rights of our residents here in Ward 7 and 8.
Absolutely. And Dr. Marilyn Corder, we thank you. Dr. Marilyn Corder is a shero in healthcare in our community, and we should always be lifting her up in appreciation for everything she's done. And then I'm going to ask Dr. Malinow and also Dr. Chapman for their final words. Let's start with Dr. Malinow. If you can join us with your final words and remind us what's happening on this Wednesday, January 28th at 8 p.m. with a webinar with Senator Van Hollen on Medicare for All. Dr. Malinow is with National Single Payer.
Thank you, Joni, and thank you, everyone, for your incredible work. I suggest that somebody write a book about this, by the way. That's not going to be my final comment, but that is a recommendation. I agree we have a criminal healthcare system that can provide the best healthcare in the world and the worst healthcare in the world, and it's based on your ability to pay. We spend $4.8 trillion in 2023 on our healthcare system, so we have the money. We outspend almost every other country by twice as much, yet our outcomes are not anywhere close to what we're paying. So we have the money, we have the resources, we have the healthcare knowledge, the medical knowledge, the doctors, obviously. But the problem is that we do not spend our healthcare resources according to need. And that's what we need. We need a healthcare system that distributes our healthcare dollars according to need. We don't need 10 hospitals where the rich people live and 0 hospitals where the poor people live. I mean, that's how it's being distributed today.
Right.
We need a network of community health centers and community health clinics where people live. And that's what Senator Chris Van Hollen is going to be talking to us about. Medicare for All, National Improved Medicare for All, Wednesday, January 28th at 8 p.m. Eastern. Please go to our website, nationalsinglepayer.com, and register for the webinar. And thank you again for all the amazing work you're all doing.
Thank you, Dr. Malinow. Last but not least, Dr. Chapman, your final words for today.
80 years ago, my father was the first head of the Urban League in Gary, Indiana, and in 1947 was able to get the first 2 Black physicians hospital privileges in the 2 white hospitals in Gary. Dr. Edward Mazik was the first Black physician to get hospital privileges in Washington, D.C. And I would remind you that in 1964, Dr. W. Montague Cobb was the only physician in the room when President Johnson signed the Medicare Act. And that was because the National Medical Association supported Medicare when others did not. So this past weekend, we had the W. Montague Cobb Health Disparities Institute, chaired by Randall Morgan from Gary, Indiana. And this is really what we discussed, this terrible history and how we can make a change. And at that meeting was the current president, the current 126th president of the National Medical Association, Dr. Roger Mitchell. And we had a discussion. We're going to have a Zoom call tomorrow, and we have ideas about how we can bring innovations to the table to reverse this terrible healthcare system. And we know how to do it. We've done it before, and we're going to continue to fight to do it. So we're going to bring top people from across the country.
Absolutely. And we appreciate you tremendously, Dr. Chapman. And I believe your father was also there, if I'm not mistaken, with Dr. Paul Corneli, who also worked side by side with Montague Cobb and others, was a critical person in the history of this country in healthcare and also with Howard University. So we lift up our heroes. I want to thank Robert, our engineer for today, who gave me tremendous help. Thank you so much, Robert, because I don't have my email. I don't have anything. I'm thankful to be able to make phone calls. So thank you, Robert. And remember, folks, we still need to continue to organize for healthcare based on people and not profits. And remember the words of Dr. King, injustice in healthcare is the most shocking and inhumane. And far too many of us are witnessing that firsthand. So stay tuned for the next show. Mark Thompson, Make It Plain, and listen to Ambrose today at 5 p.m. Thank you, everybody.
To eat.
How can you think of love